Smegma are the white and yellowish, soft cheese to sometimes harder cheese like Parmesan consistency buildup under the foreskin in males and under the clitoral hood and around the labia in women is a very common phenomenon. In this video, I'll review Smegma essentials and walk you through the best and healthiest way of maintaining it at a healthy minimum. Dr. Yuval Bibi, dermatologist, mission break you out of the skincare matrix of genital skincare nonsense and set you on the path to winning with Smegma without setting your genitals on fire. Smegma has a few major building blocks. Dead skin cells or corneocytes that are shed from the surrounding skin and mucosa. Sebum, which is a complex of oils that are secreted by the skin and the mucosa, as well as water, and a number of other factor categories, including proteins, some of which are enzymes and some of which are immune-mediating factors. In most cases, it is part of the normal turnover of secretions around the genitals, foreskin, and other adjacent bits. Because it is secreted mostly by the foreskin, it is most often seen in males who have not been circumcised under the foreskin where it can build up sometimes. Smegma has a mild musky odor like normal genital smell. I know it's weird, but you have to get a grip on what is normal, and most smegma is completely normal. Smegma is not categorically dangerous and should be regarded as a completely normal phenomenon in most cases. Removing smegma does not serve any physiological purpose in the vast majority of cases. It is an aesthetic practice, but an understandable one, especially in cases in people where smegma accumulates at higher numbers and becomes unesthetically pleasing, maybe even a turnoff. Smegma rarely occurs in children. It picks up speed in teenage years. It is maintained throughout adulthood until later years where it may slow down. When should you be alarmed by smegma? Major signs are very strong odor, sharp and nauseating, which could be a sign of a fungal or yeast infection, as well as inflammatory conditions such as Zunes, vulvitis or balanitis, seborrheic dermatitis, psoriasis, or very rarely penile cancer or vulvar cancer. With a very strong fishy odor, you're probably dealing with bacterial overgrowth or infection. Noticeable changes in the color of smegma should also alert you to the possibility of something going on and prompt you to check with your physician. Pain and discomfort around the smegma area are also signs that something may be going on. With any of these symptoms consistently and persistently occurring, see your board-certified dermatologist or any physician belonging to overlapping specialties such as urology, OB-GYN, primary care, or internal medicine. How do you get rid of smegma? First, do no harm. As I often tell people, avoid harsh skin care to your skin, especially around the genitals. That means avoid hot water, avoid detergents, as in soaps, shower gels, body washes, cleansers, anything that comes in a bar or a bottle. These things are inherently harmful to the skin and will be double harmful to the genital area. Also avoid physical abrasives such as loofahs, brushes, washcloths, rags, exfoliating gloves. Don't even get too aggressive with your hand, as that can also abrade the skin and cause major harm to the area, maybe even making the problem worse. Use lukewarm water when treating the area. The warm water will likely soften up the smegma a little bit and make it easier to remove. Never use a water-based wipe to remove your smegma. Water-based wipes like baby wipes, wet wipes, disinfecting wipes are packaged in water and must contain preservatives as well as other ingredients such as fragrance. They can be inherently irritating and cause major damage to the area. To remove the smegma, retract the foreskin or the clitoral hood, separating the parts, and aim a very weak stream of lukewarm water to the area, gently and patiently getting rid of the bits until you're all done. It's okay to leave a little residue of smegma after cleaning. In most cases, smegma will come right off and wash away. If your privates produce smegma regularly, it is okay to get in the habit of removing smegma semi-regularly, maybe every few days or once a week. And if it's very frequent, you can do it every day or every other day. Just be careful with the approach so that you don't aggravate the area and cause irritation of the area. If smegma is harder to remove, hard and consistency, consider soaking. Fill up the tub with lukewarm water with no soap or any bath products and sit in the bath for a few minutes, 5 minutes, 10 minutes, 15 minutes, until your smegma achieves the right consistency, and then gently remove it from the area using your hands without picking at the area and aggravating it physically. Don't have a bathtub? Get creative. For men, you may use a bowl filled with lukewarm water, where you can soak the penis in it for the same duration of time, gently removing the smegma, gradually getting rid of it. For women, consider pre-packaged wipes that are coconut oil wipes, which I've included in the description. To summarize, smegma is a completely normal physiological phenomenon that is not inherently problematic, but may cause aesthetic issues, which requires removal. Removal should be done as gently as possible, using no detergents, no physical abrasives, no water-based wipes, and is often done effectively with lukewarm water only, either through a weak stream of water or soaking. Harder, more stubborn to remove cases may require longer soaking in a bathtub or another dish of water. And in women and also in men who do not have the means to soak in a bowl, you can use coconut oil wipes to remove the smegma gently until satisfied. Let me know in the comment section how this video affected your smegma removing practices. Also, don't forget to share, like, and subscribe for more no BS skincare advice. See you next time. God bless.